Mark, you're killing me. Welcome back, students. Today we're going to talk about splinting, the different supplies, and the pros and cons of each different device. So a very simple way of splinting is the cardboard splint. The cardboard splint is used commonly in a lot of rural areas. It's a cost-effective splint. You would secure it by, this one's been well loved on, but you would secure it by flipping the foot up, but it doesn't always have to be a foot. These two would secure here, and you would tape it. There's also opportunities for this to be, put a bend in it. That can be done by cutting down the sides on each side, and it will fold up. This one's already been done. So you would cut, tear, crease, whichever you'd like, fold this up, and then this would be folded up. So you can make a really nice elbow splint for this, or an ankle splint, anything that's going to have kind of more of a steeper angle. Cardboard splints are excellent for. The other type of splint that we see commonly used is a SAM splint. A SAM splint is a very thin aluminum piece of aluminum metal that has a slight padding over it. As it's straight, it is not rigid. SAM splints need to have multiple layers, ideally, and also it needs to be cupped in order to get any rigidity. So when you're using a SAM splint, it's really important that you fold it and you cup it so that you have that stability that it's best known for. SAM splints are great because they're small and you can put them in a backpack and take them lots of places, so they're very well for traveling. The other thing is a vacuum splint. Vacuum splints are great if you have a lot of space on your rig and it's not, you're not limited on how much material that you can pack with you. A vacuum splint is like a bag that has like little beads in it, for lack of better words. You will take the pump device, attach it to the end. Right now it's supple and it doesn't have any hardness or structure to it. So then you will go ahead and you'll pull out all the extra air and it becomes rigid. So that's the vacuum splint. The other thing that you're going to go over is ace wraps. Some people like to secure their splints with an ace wrap. It is very common for students to have the opportunity to learn how to hold these and not drop the whole ace wrap and have it roll off. One common way is if you think it like toilet paper, and you'll take it and then you can hold this and you can roll it onto the patient's arm, as opposed to like this. It's a lot harder and you tend to sometimes pull it overly tight. You have to be careful with an ace wrap. It is very easy to constrict it and to limit the blood flow, which is opposite of what your goal is. So ace wraps. Cravats. A cravat is like a piece of triangle material. A swath is something that is like some sort of material that you go around to secure something to your body so it can't move away. So a cravat is a triangle piece of material. These are common. They are made out of like muslin. These are the kinds that you would find like in pre-made first aid kits, etc. You might have these on your departments. I personally do not like these. I do not think that they have kept up with times to the size of our patients. So I tend to make a lot of our own cravats. And so these are large. A typical way that you would tie a cravat is you would take this, tie a knot at the end. The top of the pyramid is what I typically say. Take your two ends, and then you can slide the patient's arm in, and then you can secure it. A swath can be any piece of material. You could take a cravat if you want to, fold it over, and then you could use this as a swath if you would like. or you could use any straight piece of material. These are just a few of the things. Splinting is one of these opportunities that you can be creative. You just have to follow your goals. Did you manage the above the injury, below the injury, and did you relieve the distal weight from the injury? So this is one of the opportunities. Follow the goals and use your equipment, but you can be creative. Think about how long your patient is going to be in that splint. So along those lines, you also want to make sure you pad the splints appropriately. For example, if your patient has a long transport time, think about how long they're going to be in there and how comfortable that is. This cardboard is not comfortable. So if you lay a towel, or if you have extra cravats, you can use those for padding. It's just important that you think about patient comfort, because you already possibly have compromising blood flow and you don't want to have it be worse. You want to think about anatomically correct positioning of the hands. So it's important, like if you were doing an arm, that you maybe want to put something light in their hand so they can hold it and keep that hand in that inline neutral position.